to end homelessness. Today we're going to discuss the presentation, Westchester Coordinated Entry, Key Elements. The purpose of coordinated entry. The purpose of coordinated entry is to make access to multiple housing and homelessness prevention programs easy and fair for everyone experiencing homelessness in Westchester. The coordinated entry system is fair because each person or household is helped in priority order based on how long they have been homeless and the specific challenges of their personal situation. This way, everyone is treated equally no matter who they are, what organization they contact first to access help, or where in the county they live. Coordinated entry only works if all agencies serving people experiencing homelessness work together to move clients into permanent housing.
Scope of service, coordinated entry contract. The coordinated entry or CE Assessor at each shelter is the initial and primary contract for coordinated entry to other elements of the CE process, including the DSS CE Administrator, housing providers, outreach personnel, and CoC staff. The CE Assessor is responsible to coordinate with these individuals on a continuous basis to ensure barriers to engagement in the housing process are identified and addressed on behalf of clients. The following are additional responsibilities for the CE Assessor. Complete and upload the HMIS release for every client, complete HMIS data elements, enroll clients into coordinated entry in HMIS, including all data elements, provide CE participants with a CE receipt, info sheet, HMIS release, assess all eligible clients using the Comprehensive Homeless Assessment Tool or the chat, ensure that clients' months homeless is correct in HMIS, and upload any relevant documentation. Obtain and upload documentation for time spent homeless on the street, in a vehicle, or location not intended for human habitation, as well as time spent homeless outside Westchester County. Ensure that client's disability is clearly documented in HMIS, as well as collect any relevant documentation. Scope of service for coordinated entry continues. After being notified that a client has been referred for housing by the DSS CE Administrator, the shelter or CE Assessor is responsible to respond to all parties on the referral email to confirm receipts within 2 business days, notify client when a referral is made, and discuss the process with client, whether the client is notified verbally or in writing. Verification of notification is required in writing on organizational letterhead, uploaded into HMIS within 48 hours of referral. Provide the housing provider with all documentation requested. Direct them to its location in HMIS, or provide a reason why documentation is incomplete within 10 business days. Arrange meeting between clients and housing provider staff. Participate in case conferences with housing provider when necessary. Communicate and coordinate with housing providers to transition participants to permanent housing. Contact the DSS CE Administrator to resolve any issues which arise during the referral process. Respond to requests for the DSS CE Administrator. Notify clients of eligible referral decisions. Scope of service coordinated entry contract. Participate and request in CoC training events and meetings. Attend monthly coordinated entry meetings and DSS CoC provider meetings. Attend monthly and be prepared to actively participate in PHS, Permanent Supportive Housing, or RRH, Rapid Rehousing Coordinated Entry Referral, CERC meetings, which maintains the by name list of all coordinated entry participants and allow coordinated entry assessors and housing provider staff to coordinate actions needed to move every household into permanent housing.
Key elements of coordinated entry: access, assessment, prioritization, referral. Key elements of coordinated entry continued. Access. Our access points include all DSS district offices, emergency shelters, drop-in shelters, and our street outreach workers. Assessment. The length of time homeless measured in the number of months homeless in the last 3 years. The CHAT, Comprehensive Homelessness Assessment Tool, produces 2 scores used to prioritize the customer on a list. The CHAT must be recorded in HMIS. These 2 scores, one for permanent supportive housing and one for rapid rehousing, are generated for each client. Participants are also assessed for specific disabilities. Prioritization. The number of months homeless and their CHAT score will determine the client's place on the list. The list is system generated in HMIS. The prioritization list is sortable for length of time homeless, CHAT score, disability, number of household members, and other eligibility factors.
Referral. Referrals are made by DSS Coordinated Entry Administrator using prioritization list in HMIS. At referral, an email is sent to the housing provider, staff, and coordinated entry assessor at most recent access point used by the client. Referral triggers coordinated entry assessor and housing providers to work together to transition participants in permanent housing as swiftly as possible.
Coordinated entry assessor key tasks. 1. Enroll participants into coordinated entry in HMIS. Update the data for the number of months homeless, and it must match the check-in records in HMIS or be supplemented by documentation uploaded into HMIS. Include data for barriers and disabilities, which must also be supplemented by documents uploaded into HMIS. Completed chats in HMIS. Provide coordinated entry participants with a coordinated entry receipt, info sheet, and HMIS release form. All coordinated entry clients must have the number of months homeless matching HMIS check-in records plus any uploaded supplemental documentation to have a picture of their full-time homeless. Disabilities should match uploaded documentation, and they must have a completed chat.
Coordinated entry assessor key tasks. The system calculates shelter and outreach check-ins to provide base number of months homeless at CE enrollment. Use this number unless documentation of additional time homeless has been uploaded into HMIS. Maximum 3 months of self-certification on the street. If system calculates participant has been homeless 9 months, but the person says they were in the streets as well for 4 months, enter 9 months, or uploads signed self-certification for extra street homeless and enter 12 months homeless. The coordinated entry enrollment receipt is required every time a client is enrolled in the coordinated entry process. This form has a space for a customer to sign as well as staff to sign, and then needs to be uploaded into HMIS.
Coordinated entry assessor key tasks. Link coordinated entry participants to permanent housing after referral. This includes notify the client when the referral is made, arrange meetings between the client and housing provider staff, obtain and upload documentation of time spent homeless on the street, in a vehicle, or other location not intended for human habitation, as well as time spent homeless outside of Westchester County. Contact Coordinated Entry Administrator to resolve any issues which arise during the referral process. Link Coordinated Entry participants to permanent housing after referral. Coordinate with housing provider staff, outreach personnel, Coordinated Entry Administrator, and COC administrative staff on a continuous basis to ensure barriers to engagement in the housing process are identified and addressed on behalf of clients. Coordinated Entry Assessors are the initial and primary contact for coordinated entry to other elements of the coordinated entry process, including Coordinated Entry Administrator, housing providers, and COC staff. This is the Coordinated Entry Flowchart. There will be a separate demonstration and walkthrough of the flowchart available to you. This takes you through the customer access points, what happens at a Coordinated Entry Assessor access point, and the Coordinated Entry Assessor's key tasks, and what to do if an appropriate agency placement is not appropriate, there is unsuccessful engagement, or an unsuccessful placement. Attend all Coordinated Entry Referral Conference meetings, or CERC meetings. These work groups maintain the by name list of all Coordinated Entry participants and allows Coordinated Entry Assessors and housing provider staff to coordinate actions needed to move every household into permanent housing. The Permanent Supportive Housing CERC meets once each month on the third Tuesday at 11 a.m. in room 601 of 112 East Post Road. The Rapid Rehousing CERC meets once each month on the fourth Tuesday at 11 a.m. in room 601 of 112 East Post Road. Participate as requested in relevant COC trainings and meetings. Coordinated Entry Committee meets once each month on the third Tuesday at 10 a.m. in room 601 of 112 East Post Road. Remember, Jo Marie, Allison, and Craig are available as needed if you have questions or concerns about any client. Please also keep in mind, this presentation was recorded during the COVID-19 emergency period. In-person meetings are not being held at this time until the COVID-19 emergency state is lifted.
All material related to coordinated entry can be accessed through the link shown on your screen, and documentation, forms, or anything relevant to the coordinated entry process can be viewed on the COC website listed here.
Our website is cochomeless.org, and information specific to our coordinated entry is available on the menu on the front page.
For any additional questions or concerns, please reach out to the names listed on this page. Jo Marie Tarshun, who is our Program Administrator, Coordinated Entry Administrator. Craig Wong, Program Administrator. Allison McSpadden, Systems Manager, PD&D. Carl Bertram, Co-Chair. Annette Peters-Ravolo at DCMH. Thank you for viewing this training.
Welcome back, everybody. So that was our first ever recording of a demonstration. You'll have to give us feedback on that after the meeting today. Therese, do you have a handle on what questions we need to address from this recording?
So far, 0 questions.
All right. Does anyone have any questions from what they just saw? All right. Everyone's an expert, I hope. Let me pull up some more content here. And that's going to be the walkthrough of the flowchart. And now I'm viewing someone's screen that I shouldn't be viewing.
That was at my screen.
Okay. Welcome to the Coordinated Entry Flowchart demo, presented by the Continuum of Care Partnership to End Homelessness in October of 2020. If you're acquainted with Coordinated Entry and RCOC at all, you recognize this flowchart. You also recognize that it's extremely difficult to see the information in all the boxes in our previous presentations and Zoom talks. I'm going to walk you through what's in all the boxes and what it means. The Westchester County Coordinated Entry Program provides universal services to all people who are experiencing homelessness in Westchester County. Sorry, folks. Let me see what I can do here. Clients or customers use coordinated entry by entering through an access point. These access points include street outreach personnel, local district offices of the Department of Social Services, drop-in shelters, and emergency shelters. At a coordinated entry point of access, a dedicated staff member called the Coordinated Entry Assessor will use our HMIS system to enter the client into the coordinated entry project. They will have to complete the Comprehensive Homelessness Assessment Tool, also known as the CHAT, complete the COVID-19 risk assessment, and collect eligibility documentation. This documentation includes documentation of disability, verification and any additional documents toward the time homeless, verification of any U.S. military service, and verification of income or benefits. Please note, at the time this presentation was recorded, we're currently in a COVID-19 state of emergency. The COVID-19 specific assessment is only required during the state of emergency. Based on the CHAT score and length of time the client has been homeless, The housing prioritization list is generated by HMIS, and the Coordinated Entry Administrator maintains that list. The Coordinated Entry Administrator refers the client or household at the top of a prioritization list to an available opening in a COC housing program where the client meets the preliminary eligibility criteria. The appropriateness of housing referrals can vary. On the left side of the slide, we see if the placement's not appropriate, and on the right side, we see what happens if it is. If the placement is not appropriate, the agency will communicate with the Coordinated Entry Administrator and upload an agency referral denial form within 15 days into HMIS. The housing provider will change the referral status in HMIS to show rejected by provider. The client or household returns to the prioritization list for re-referral to a more compatible program, and the next client on the prioritization list who meets the preliminary eligibility criteria for housing is referred. If the placement is appropriate, the Coordinated Entry Assessor coordinates with the housing provider staff to facilitate engagement with the client. Engagement around housing referrals. If the engagement is not successful, if the housing provider is not able to connect with the customer within 10 business days, the housing provider will communicate with the Coordinated Entry Assessor and Coordinated Entry Administrator before uploading an agency referral denial form in HMIS. The Coordinated Entry Assessor must assist the housing provider and client in engagement for the referral. The client's referral status in HMIS would be changed to rejected by provider. The client will either be returned to the prioritization list for re-referral or exited from coordinated entry, depending on the reason for the unsuccessful engagement. Please be aware that the current COVID-19 policy supersedes the coordinated entry policy on denials during the COVID-19 state of emergency. Please check the COVID-19 policy guidelines before denying any client on the basis of not being able to contact them. If the engagement with the client is successful, the client will receive clear information from the housing provider about the program they have been referred to, as well as the expectations of them in the program. Once informed, the client has the right to choose whether to accept the housing opportunity or decline. If the referral is declined by the client, the housing provider will notify the Coordinated Entry Assessor and Coordinated Entry Administrator before uploading a customer referral denial form to HMIS. The housing provider must then change the client's status to rejected by client in HMIS. The client is either returned to the prioritization list for re-referral or exited from coordinated entry, depending on their reason for the denial. If the referral is accepted by the client, the housing provider begins the intake process within 3 business days. The housing provider enters the project start date in HMIS and changes the client's status to accepted. Successful housing placement and moving in. The Coordinated Entry Assessor works with the client and the housing provider to obtain any final eligibility documents within 10 business days after the intake process has been started. The housing provider, with the cooperation of the client and Coordinated Entry Assessor, locates an appropriate housing unit and arranges move-in. Ideally, this would happen in 30 days. However, we are aware of the housing market that we're in. So this is a goal, 30 days. Upon moving in to their brand new unit, the housing provider records the client's move-in date in HMIS and notifies the Coordinated Entry Administrator within 1 business day of the move. That concludes our walkthrough of the Coordinated Entry Flowchart. For more information about Coordinated Entry policy, processes, and documentation mentioned in this demonstration, please visit our website, WCoChomeless.org/coordinated entry. There, you'll find all of the documentation and information required for clients to successfully move through the coordinated entry process and gain housing. All right, so that's our next unit there. And thank you to Therese for uploading that coordinated entry flowchart.
We have a few questions. Do you want us to wait or do we have
Oh,
time?
no, why don't you tell us what the questions are, and then Craig and you and me and Jesse can join in, and as well as Daniel as appropriate.
Okay, so the first question is from Chris John. Will there be a follow-up walkthrough on how to find and enter data into HMIS? This question came in when you first started the presentation.
Right, that's actually going to be one of the things that we addressed today. Daniel Gores created a bunch of content for us actually showing how to enter and walk through HMIS coordinated entry. So we'll definitely be addressing that.
Perfect. Second question from Martha Leonard. Once a client is referred for housing, that housing provider has 10 days to reach out to the client or make contact.
That is supposed to be 10 days of trying to reach the client.
So 10 days of reaching out.
Mm-hmm.
Okay.
10 days of reaching out, documenting that reaching out, and having made at least 3 attempts to do so.
Okay.
And the reason that it says in the flowchart that the coordinated entry assessor must assist the housing provider isn't just a note for coordinated entry assessors. It's a note for housing providers to utilize the effort and the physical presence of the coordinated entry assessor at the client's location.
And the third question from Callie Blanco. What happens if there is no contact within that time period?
Right now, we're going to watch the next section is the COVID-19 policies from our COC, as well as the COVID-19 waivers from HUD. So right now in October of 2020, when we're making this, if we can't find a client and we have exhausted all efforts to find them, we're not going to deny them on the basis of not being able to find them, because people are having to do creative things in order to avoid getting sick or having to stay at different places if they are sick. They could be hospitalized, they could be doubled up, they could be in a rehab center, they could be going through a lot if they are sick with COVID-19. So we don't want to make that a reason that someone's denied for housing.
Just to add to that question, one of the things that we've asked shelters and housing providers is just to communicate. If you're unable to find the customer, if the customer is not reachable, please send an email to the housing provider, let Jo Marie know, the coordinated entry administrator, so that we're all in the loop. One thing we don't want to see happen is that people are asking questions and there's no response. The sharing of communication is very important. Another note on the first presentation, the CE receipt is actually an updated CE receipt on the website, which now has a line for the customer to sign. So just a note, the customer should sign the coordinated entry receipt when they're entered into the system, and it should be uploaded into HMIS.
Can I also build on what Craig just said? After the 10 days, what happens depends on the reason for there being no contact. Obviously, if it's because the housing provider hasn't reached out, then the referral is not affected. If it's because the coordinated entry assessor isn't being responsive at the access point, the referral is not affected. It's intended that time, if everybody working together is unable to contact the client, then the referral can be canceled at that time. Otherwise, the party that's working should contact Jo Marie or Allison or Craig and have them reach out to the side that is having trouble locating the client.
Yeah, and I mean, we're all working in extraordinary circumstances right now. So if you are expecting to hear from someone or you're reaching out to them and you're not hearing back, please let me know. I will do my very utmost to help you track down a response. It's just so important that none of us operates in a vacuum at this time, even though we might be more isolated in our work than we have been before. So please, please talk to one another. You're all team members on behalf of clients on this. And when you get that initial referral email from Jo Marie, and it says the people's names on it who are connected to the client, that's where you start building your team for the client. I don't know is an acceptable answer. If you legit don't know something and the housing provider's asking you or the CE assessor's asking you, you can tell them you don't know. You can proactively tell them, listen, I'm really trying to get a hold of this client. I left them a letter. I did this and that. You know, let them know where you're at with it. Don't just be working in silence and feeling resentful that, you know, you're feeling nagged. You know, just let us know what's happening, and you know, we're all trying to work together.
And one more question from Shawan May. At which point will the coordinated entry assessor be notified if a client cannot be contacted?
There shouldn't be a point that the CE assessor is notified that the client can't be contacted, because the housing provider and the coordinated entry assessor should be keeping each other in the loop at all times. The housing provider should be telling the CE assessor prior to that 10-day mark that I can't find your client. I tried the phone number you gave me. I tried looking on the corner where you said they would be at the time you said they would be there, and I can't find them. You know, that conversation should be happening way before the 10 days. And that 10 days is a guideline. If it's day 10 and the housing provider just now says to the coordinated entry assessor, I can't find this client and I'm denying them, it's on the coordinated entry assessor to say, well, wait, you need to talk to me about this because this client has been sitting here at having lunch every day, and, you know, let me reach out to them. So we're not accepting denials because one person said they couldn't find someone. It has to be multiple people said, yes, we searched high and low and we couldn't find them. We don't want our system to be the reason that people are homeless or stay homeless. Also, Jesse wanted me to remind you at this point that this is why the CERC meetings are so important, because you get to interact with people face-to-face that you're working with on your clients, and all in one go get a rundown on everybody that you have in common. You shouldn't only be coordinating at CERC meetings, but it's definitely helpful to get caught up or get as much information as possible. And assistance in removing the barriers that the client's facing, if it's possible to do so, from other partners at the table.
Great questions. Thank you all.
All right,
Thank
so
you.
let's try to do this next sharing segment a little more smoothly. Hello. We're going to talk about the policy changes created to cope with COVID-19, specifically the COC moratorium and HUD waivers. This presentation is brought to you by the Westchester Continuum of Care Partnership to End Homelessness in October of 2020. The Westchester Continuum of Care Partnership to End Homelessness has made changes to our policies, creating a moratorium on certain time constraints within our existing coordinated entry policy. This is to help clients and staff continue to move forward with the housing process during the COVID-19 state of emergency. The U.S. Department of Housing and Urban Development has also provided 5 waivers to their existing requirements regarding documentation. It's important to note that the expiration dates vary by individual HUD waiver. We'll start with the COC moratorium. Effective beginning April 9th of 2020 through the end of the declared state of emergency in Westchester County. In order to assist clients, shelter staff, and housing providers as they face the new challenges brought about by COVID-19, the COC Board is commencing an immediate moratorium on all denials by housing providers on the basis of lack of client response and lack of client documentation from shelters and CE assessors. This moratorium will remain in place until the state of emergency ends in Westchester County. We believe that temporarily lifting the time-sensitive requirements will better enable shelter and housing staff to respond to more immediate client needs during this emergency. The affected policy stipulations related to time, which are waived to facilitate this moratorium are: coordinated entry assessors, shelters, and homeless outreach workers are currently required to provide documentation on referred clients within 10 days. This will be waived. Housing providers are currently granted 2 weeks to connect with clients. This will be waived. And clients are currently limited to 2 weeks to respond. This will also be waived. These measures assume that housing referrals will be made by our coordinated entry administrator as usual, and that all possible effort toward housing will still be made in as timely a manner as possible and in good faith by all parties. It is important to note that denials for other reasons can proceed as normal. This includes denials based on clients who are documented as not meeting program criteria, as well as denials by clients who are documented not to be related to COVID-19 changes in accessibility. HUD waivers. Effective beginning October 10th, 2020. The end dates on these waivers vary by individual waiver. Waiver 1, fair market rent limit. The FMR restriction on rent subsidies for individual units for leasing projects is waived for any lease executed beginning October 10th of 2020. Leasing project rent amounts may exceed the 2021 FMR, but must still be certified as reasonable rents. This waiver expires on December 31st of 2020. Waiver 2, housing quality standards, initial inspection of units. Requirements for HQS inspection before providing assistance on behalf of a program participant is waived beginning October 10th of 2020. The owner must certify that they have no reasonable basis to have knowledge that life-threatening conditions exist in the unit or units in question, and the subrecipient housing provider has written policies to physically inspect the unit within 3 months after the end of the COVID emergency. This waiver expires on December 31st, 2020. Waiver 3, the homeless definition, temporary stays in institutions and homelessness status. An individual who meets the definition of homelessness by residing in a shelter or on the street retains homeless status and may go directly into COC housing throughout stays in institutions up to 120 days. Prior to this waiver, the limit was 90 days. This waiver expires on March 30th, 2021. Waiver 4, disability documentation for permanent supportive housing. COC projects may enroll clients without a certification of disability by a state licensed professional. Housing provider intake workers are instead allowed to certify the disability by observation, or the client may self-certify in writing at enrollment. In effect, no homeless persons should be delayed in access to housing because they are waiting for the certification of disability from their treatment professional. This waiver should only be employed in cases where required documentation will be feasible to secure once the COVID-19 emergency is over. To ensure this, subrecipient housing providers are required to receive approval from their HUD grantee before housing an individual or family using this waiver. This waiver expires when the COVID-19 state of emergency ends. Waiver 5, Coordinated Entry Annual Planning and Stakeholders Meeting. Normally, all COCs must hold a forum to solicit feedback on coordinated entry from clients and participating projects. This waiver expires on September 30th of 2021. Your COC admin team is available to help you with any questions or with the implementation of any of the waivers that are discussed in this presentation. Your coordinated entry staff includes Jo Marie Tarhoon, Coordinated Entry Administrator, Craig Wong, DSS Program Administrator, and Allison McSpadden, Systems Manager. Also available to you through our Westchester County COC are co-chairs Carl Bertrand and Annette Peters-Ravulo, as well as Program Specialist Yoav Spiegel. Please take us up on our offer to help you out with questions about these waivers and how you can use them to help clients. Okay, does anyone have questions about the segment we just watched?
Well, there are no questions in the chat box.
Okay, has anyone thought of any since it ended before we move forward? Daniel Ivy, you have a question regarding the FMR waiver? So basically the FMR for 2021 is lower than the FMR for 2020. This has run into some trouble for some folks, especially as we move through COVID-19 and are trying to get a hold of units that might be harder to get a hold of. So HUD is waiving the FMR in favor of rent reasonableness. And Daniel's question is specific. What happens once the lease is up and the waiver is no longer there? Yoav, do you want to speak to that? You're on mute, Yoav.
I'm sure I understand the question. The waiver applies to leases that are executed, signed by between October 10th and December 31st.
And then what happens when
those single leases? I mean, if you sign a 1-year lease, a 2-year lease, that lease is protected by the waiver if it's signed by December 31st. Any leases that are signed after that, which would be the renewal of all of the leases that are covered by the waiver, are not covered, will have no waiver, and the FMR will be a hard limit to rents subsidies on leasing line projects, COC leasing line projects, and yeah.
So if you sign this lease now, what happens when the lease is renewed?
The FMR will apply, presumably the FY 2022 FMR, if you sign a 1-year lease between 10/10/20 and 12/31/20, the lease will expire after October 1st, 2020 and be covered by the 2021 FMRs. We don't know what those will be. They won't be released by HUD until September next year, but they will not be vastly, they may be slightly higher than current or slightly lower. I think that it's probably operationalizing this waiver It should be mostly used to keep rents the same if you were renting at or just under FMR or 2019 FMR, so that if the 2020s were, since they've gone down only about 1.5%, about $20 for one bedroom, $30 for two bedrooms. So it's not a huge decrease, but it is a decrease. So if you were renting at FMR last year and landlords are unwilling to lower the rent to the new FMR, you can keep at the previous FMR for this 1 year. It would probably be dangerous to use this waiver to sign a lease high above the 2020 2021 FMR, because that when you renew, you will be covered by the FMR.
Thank you. And then Jamie Jackson asked, how should shelter staff refer a client for coordinated entry that's not on the list to be selected for housing, assuming the client meets qualifications? The short answer is you can't. A client has to be enrolled into coordinated entry in order to be on the prioritization list to be referred for any COC housing resources. Let me know if I misunderstood the question, but basically you need to be on the prioritization list and you need to be referred by Jo Marie, who is our coordinated entry administrator.
There shouldn't be any client that qualifies for housing that is not in coordinated entry. Every single 24-hour shelter client must be enrolled in coordinated entry within 24 hours of arriving in your shelter, and drop-in shelter clients are enrolled in coordinated entry after they have 14 check-ins system-wide. And of course, they can be enrolled in coordinated entry before that if they request it or the shelter wants to.
Right.
So there are very, very few. I mean, everybody in our system should be enrolled in coordinated entry. That's the intent. Right.
Right, and as Daniel mentioned in his response comment, he said you can direct the client to your coordinated entry assessor so they can enroll them in coordinated entry and administer chat. Clients can be connected to more than one coordinated entry access point as well. They may have an outreach worker in addition to utilizing the drop-in shelter, or they may visit the DSS district office. So Jamie said, I meant the client has been enrolled in coordinated entry, however, they haven't been selected for housing. At any time, if you think that a client is eligible, our permanent supportive housing, you have to have a score on the chat of 5 or greater, and more than 12 months homeless, documented in HMIS for them to appear at the top of the prioritization list, and for Jo Marie to be able to see, this is the next most qualified person for this housing. So if you have done everything you need to do in terms of making sure that coordinated entry data and the chat reflect what the client is experiencing, and you still don't see them being referred in when you come to the permanent supportive housing CERC, or you think you're going to get an email and you don't, reach out to Jo Marie and ask her, say, I have this client, they meet all the criteria, they've been homeless for more than 12 months, and ask what's going on with that client. Most likely there's some sort of data element that isn't quite right in the system, and that's the thing. That's where, so databases are amazing, and we do a lot with HMIS. It's not perfect. So if you're seeing that's something that doesn't match up with the reality that you're experiencing, bring that up, because it's not imaginary. We need to help you work through whatever it is to work with better for the clients.
And a question from Maria.
Yeah, if a client is already enrolled in coordinated entry through a shelter or elsewhere, should outreach workers add a second coordinated entry enrollment under their agency? No, absolutely not. When a client has an active coordinated entry enrollment, they're good to go. What you want to look at is the information that's recorded in the data for that enrollment correct? Does the chat score reflect what you're seeing from the client? Does the time homeless reflect what you're seeing from the client? Do you have disability documentation that coordinated entry assessor who started that enrollment didn't have? Anything you can add is always a good thing. And there's no credit. No one's getting an A on their report card for having claim over entering clients into coordinated entry. We want all clients in coordinated entry. We want everyone to take responsibility for the clients they serve, but there's no competitive factor or leg up of having, you know, one organization enroll a client in coordinated entry over another. And also, it can create a mess for the client if they have an existing coordinated entry enrollment that is correct, and then someone else comes along and creates a new one, and they don't include everything that should be included. So you should be combining the information you have with what is already there. How often should coordinated entry be updated? If you are working with a client and their coordinated entry enrollment has expired, you should make sure that their coordinated entry enrollment is reactivated. If you are working with a client, we'll address this later on actually, and we'll talk about when to update different elements of coordinated entry. Do families with undocumented—
Allison, also the chat, it does have a expiration date. Even
right, right, and we have a whole slideshow where we're going to talk about updating data elements and chats.
Right, because if someone is enrolled in coordinated entry, but the chat expires, the person will not be able to be referred. But we'll talk about that more.
Right, and we have one more question, and then we're gonna move on and address more questions later. Do families with undocumented parents qualify? If there is a disabled person in the household, then that household can qualify for permanent supportive housing. It doesn't have to be the adults, but it does have to be at least a child who is a citizen.
Well, it definitely, it depends. The answer to that is it depends on what type of housing we're talking about. Different types, the Department of Justice and HUD have made different rules depending on what housing it is being discussed. If for rapid rehousing and transitional housing, emergency shelter, undocumented households are eligible for. Non-dedicated plus permanent supportive housing, since anybody can qualify, can be the qualified person with qualifying disability. So those type of households are eligible there. Dedicated plus permanent supportive housing, the head of household must have the disability, and the head of household must be a legal resident of the United States. So dedicated plus beds, that sort of household wouldn't be eligible for.
And you're not required to make that determination. You can bring that case to your COC admin team and say, this family has an undocumented parent. This is the situation within the family in terms of disability, and we can let you know where they can be served in our system, if they can be served in our system.
Allison, just before you get into the next segment, just a reminder to folks, if you logging on a little later, please make sure we have your name and agency you represent. You can private chat Latanya Rosado with that information. We just want to capture everyone who's at our training today. Thanks.
All right. Okay, so next we are going to not have recorded content. We are going to have a live presenter. Jesse Johnson from West Hub is going to talk to you about documentation and required uploads and information that is specific to families in our system. So I hand it over to you, Jesse.
Thank you, Allison. Good morning, everyone. So as Allison said, the next section of our segment that we're going to talk about is what you should be uploading and documenting in coordinated entry that will support the chat score that your client gets in HMIS. Okay, so the first thing we're going to talk about on the next slide is the income documentation that should be uploaded into HMIS. So when you do a CE, okay, and you complete it, you should be uploading income that you used to enter the client's monthly income in CE. So when you first do a new CE, you should be uploading that supporting income to support the monthly income amount. So if the total household amount is $2,000, we should be able to see 1, 2, 3 different uploads that support that total amount. Another time that you should be uploading clients' income into CE is when they actually get referred. You know, you might do a CE enrollment or a chat. You might have done one 6 months ago for HMIS, and then today you see that Joe Marie sends you email that says your client has now been enrolled. What you want to make sure is the income the same or has it changed? One of the things that the housing providers are going to want to see is current income. Okay, they have to make a determination based on what is current today, not what was current when you actually did the initial chat in the CE. Okay, another question that's asked, you know, even if my client doesn't get referred and I did a CE a while ago, how often should I update new income? And we've come up with every 6 months, you should try to update new income on a client at minimum. You can update and upload income as you see fit. It's important to note that if you have a client that has, let's say, $500 monthly income today, and a month from now, they get a better job and their income doubles or triples, you shouldn't wait, 6 months. By putting in that new income amount, they potentially will move up the prioritization list and may be eligible for the next slot that's open. So again, the higher the income, the higher up the client, depending on the program, especially for rapid rehousing, the client will move up the prioritization list. Okay, so again, we don't want you trying to do this every month, but just note if there's an increase, you should try to do that as quickly as possible.
Jesse, let me interrupt you. That when you update the income, you should also do a new
update the chat. Yes.
In that case, so that the chat and the priority score based on the chat reflects that
higher amount. Correct. Thank you, Yoav. If a client is biweekly, they should, we want 2 current pay stubs. If they're paid weekly, we should have 4 current pay stubs. Other income that's important to also provide is anybody else in the household who's an adult. If somebody or even a child is getting SSI, SSD, that should be included. Child support, public assistance, DSS budget letter. And one of the most important things for now is that, you have one head of household and the chat is really only done for that person. You need to make sure that the household income in total is entered under the head of household. Okay, so if you have mom that's making $1,000 a month, but the child is getting SSI or SSD for 500, the 1,500 should be under mom in the chat to reflect the total household income. If you keep them separated or you don't include the child or the father or the significant other's income under the head of household, it won't be reflected in that person's total chat. Okay, next slide, please. Thank you. Another thing that should always be uploaded is disability. As Yoav and Allison previously mentioned, for permanent supportive households, head of household must be a person with a disability, specifically for Dedicated Plus programs. Dedicated Plus is a type of permanent supported housing program. As Yoav also mentioned, there are very few of non-Dedicated Plus beds in the COC, but we do have some. And in those instances, any family member can have the disability and qualify. Okay. A lot of times, shelter staff say, what disability is needed. So there's a form, and I'll have a link later on that, will show you an example of the form, but there's a HUD disability template that usually we ask providers to sign. These forms are must be signed and dated by a licensed treatment professional, indicating what type of disability it is. Okay, and the licensed professional must be somebody who can diagnose and treat the disability. Like sometimes we've had situations where a letter is submitted and the person signs as a case act, but the disability is schizophrenia. Okay, so that's not allowed. So it has to be somebody who can diagnose and treat the disability. It's important to note, I put a note here that some programs, like DCMH programs, have specific disability requirements. There are some permanent supported housing programs where you can have a mental health disability, a substance abuse disability, a physical disability. But some programs state that you can only have mental health. So that's also important to note depending on the referral that your client has been sent to. The letter should be on agency letterhead, and the CLC has provided below, as you can see, what the mandatory language should be on the letter from the licensed professional. I'm not going to read through it, but you can see that there are 3 specific items in the language that should be listed on the disability letter that is provided by the professional. Okay, next slide, please. Here are some other forms of disability that can be accepted. SPOAs can be accepted as long as page 3 of the application is completed. There's a link there so that, once you get this afterwards, you can download the SPOA application and you can see what page 3 of that is and what it looks like. So a SPOA can suffice as long as that's done in that manner. If a client is receiving SSI SSD, certain programs can accept the award letter or an actual check as proof of disability. So that's something else that can also be uploaded. Okay, and the third item here that can be used as proof of disability is a SHAC, as long as it also has that HUD language. Now, not all SHACs are done and include that HUD language. If it does have that, then again, the SHAC can be used as proof of disability. Okay, next slide. As mentioned, it should be uploaded into HMIS, and if you don't know how to upload documents into HMIS, I just gave a few tips right here. Once you're on the client's dashboard, you can go to Documents, click on Add New Documents, and then follow the drop-down directions as necessary to upload the doc. One of the things that's good to do is once you do this, as Yoav said, always make sure that the chat is updated to reflect this. If you had a client that you didn't have disability documentation on, and then you upload it, make sure that you go back and upload that, update that chat to now select if the client has a disability or not and what type of disability that is. Next slide, please. Okay, next section is documenting homelessness. So as Yoav mentioned before, there were different types of permanent supported housing homeless programs. The majority of our programs across the COC are what's referred to as Dedicated Plus. And we thought it's important for you to know this just so that you have an idea of your client's homeless days and how that affects what programs they potentially qualify for. So Dedicated Plus is that your client has a total of 12 months homeless within the last 3 years. So if you look at your client's check-ins on their dashboard, you can add up and see pretty quickly whether or not your client has 12 months or more in all shelters across within the last 3 years. The next type of homelessness is referred to as chronic homelessness. This is a little bit more difficult. We don't have that many programs that require this. So chronic homeless is 12 months continuous or 12 months total within the last 3 years with at least 4 episodes.
Pamela, how you doing?
Okay. And then last but not least, when we talk about homeless, all clients that are referred to permanent supported housing programs or rapid rehousing programs must be homeless the night before moving into these programs. Okay. So how that's reflected in HMIS is that it's on your end, it's the morning that you check them out, the morning that they left. And then ideally they get moved into the program that same day. Next slide, please. Okay, how do we track these engagements and these stays, these homeless days in HMIS? Okay, so the first slide we're going to talk about documenting emergency shelter and street outreach. Okay. Please note, there's an email that's gone around, and this has been brought up several times, that ideally, outreach workers and shelter workers really don't need to provide a homeless letter to housing providers as long as the correct check-in, check-outs, and units of service are in HMIS, okay? So, if a housing provider is asking for a homeless letter, but you know that the correct dates are in HMIS, the housing provider can just print out the check-in, check-out screen, and that's acceptable proof for homelessness for the housing providers, okay? For those individuals who are on the line that do outreach, 1 unit of outreach service for a client counts for 30 days for that client. So it counts for that entire month. Okay, so if you have 12 units of service, 1 for each month over the course of 12 months, that counts for 12 total months for that client. Okay. For street homelessness being documented by individuals that do not have access to HMIS, there are forms that you can complete that are stated as homeless forms for people living in place not meant for human habitation. Again, at the end of this, at the end of these slides, I'll have a link where you can download examples of these that you can use to complete. So again, for individuals that don't have access to HMIS, we've gotten street outreach letters for a person that's like a police officer, for example. They don't have access to HMIS, but if they complete this form and document that they've seen this individual sleeping, by the train station, we can accept that. So they can use this form because they don't have access to HMIS, or other people that might see some of our homeless individuals sleeping on the streets. Next slide, please. Okay, documenting homelessness when it's self-certification or institution stays. So a client that is living on the street can self-certify up to 3 months of their street homelessness. So let's say a client was at a shelter for 9 months, and then you're not sure where they went, and then you find the client and the client states that they were living on the street for the last 3 months, they can complete a self-certification doc, and the 3 months there, in addition to the 9 months in the shelter, now provides them with the 12 total months. Again, that form can be downloaded at the end of this presentation. And again, one thing to remember is that it's 3 months maximum for all time, not 3 months for every 12 months. It's 3 months total, okay? Institution stays, Allison just recently brought up that there's a waiver, and it's up for 90 days. So how institution stays work is if a client is in a shelter and then gets hospitalized, gets arrested, goes to treatment, the next, for now, because of the waiver, the next 120 days, while that client is in one of those institutions, counts as an extension of their homelessness. The key there is that they have to go from one to the other with no break. So if the client was in the shelter tonight and they go to the hospital tomorrow, it's continuous, okay? If the client's in the shelter today and then disappears for a day and then goes into the hospital, that time doesn't count. It has to be one to the other, okay? And a client can actually go from a shelter to an institution into their permanent supported housing or rapid rehousing, as long as there's no break, okay? As long as there's no days in between, the time becomes continuous. Once those 120 days or 90 days exhausts, then they no longer qualify, okay? So they have to either come back to the shelter or go into a program within those, for now, again, 120 days, and once the waiver expires, back to 90 days. Next slide, please. Okay. Shelter staff, and as most of you already know, please enter every check-in and check-out as necessary. Every day counts towards the 12 months. And for street outreach, please make sure that you are entering your units of service every time you're engaging clients on the street. Again, you know, one episode of street outreach counts for the entire month for that client. Okay, so just a reminder to please make sure that you upload that and do that in HMIS. And if you're not sure how to do that, please speak to your CE Assessor for some guidance. And there's a good chance that the what Daniel is going to be provided later on will probably show some instances of that. And again, but if not, please check with your CE Assessor or send us an email and we can assist you as necessary. Next slide, please. Okay, so here, as I had promised before, I know that we went over a lot of information. That's one of the reasons why we wanted to make sure that we were going to record this so that you can always go back and check. At this website, all those examples of street outreach or self-certification or disability, HUD language, all those examples, you can go to this website and download them, and you can use them as necessary for your clients. Okay, if there are any questions, please send them to the chat, and we will do our best to answer them. Thank you.
So it looks like Allison answered most of the questions that were in the chat during the performance. That was pretty good. Thank you, Allison. Save
You're
time.
welcome. I try. I will pull up for you folks. So does anyone have questions that the questions I answered in the chat were not specific to what Jesse was talking about. So does anyone have questions specific to the information that Jesse just shared with us?
So Marina Falcone asked if we would provide the last website. Did Jesse?
It's WCoC-HUD-regulation-documents, I think. But if you go,
I'm going to put it in the chat also.
yeah, if you go to WCoC-homeless.org, you will see a menu at the top, and it will say HUD documents and regulations, and you click on that link, and everything to do with HUD documents and regulations will be located there.
And we're also going to send out the links at the conclusion of the training. We'll blast out the email and make sure that everyone has access to the website and how to review this training as well as documentation. So you guys will get this information.
Yes. And T. Henry asks, how do you assist a family that a disability verification was provided for a child and not the head of the household? Maintaining current information allows for a more accurate understanding.
Sorry about that.
It's me.
Getting things queued up for our next section.
Again,
I think that's a repeat of the question that we answered earlier.
Yeah.
Families are going to have different circumstances and fit into the available housing programs we have in different ways based on what the criteria for those housing programs are. So if you have a child that has a disability verification, that should be uploaded into HMIS in the head of household's record so that we can see that when we are ready to refer the family to make sure that we're getting housing that is specific to the family that we're working with. So all the income should go in the head of households, and all of the disability documentation should go in the head of household record in HMIS.
Of course, if neither of the parents are disabled, that family may be appropriate for rapid rehousing and can be referred there. There are very, very few non-dedicated plus slots that would be for permanent supportive housing that would be able to house that sort of family. Be aware. There's probably only one per year that opens up, since there's really only two projects that have non-dedicated plus family slots.
And just so that everybody knows, I just put the website up there where you can find the HUD regulation and forms, so you can get it off of the chat right now.
Thank you, Jesse.
All right, so our next segment is brought to us by Therese Thomas. So I will hopefully it is set up as it is supposed to be. Or not. Here we go.
Maintaining current information allows for a more accurate understanding of client eligibility for housing programs and a more accurate understanding of clients' needs. Assessments should be updated as contact information or life circumstances change. The Comprehensive Homelessness Assessment Tool, aka the CHAT, must be completed during the initial coordinated entry assessment. The CHAT must be updated every year thereafter. If there are changes in the person's life, update the CHAT. For example, hospitalizations or the diagnosis of a disabling condition, change in family composition, change in income. If a person becomes homeless again, complete a new CHAT. When new information is revealed or becomes available after the initial assessment, you must update the CHAT. Household financial information must be updated immediately upon referral, at least every 6 months, and within 30 days of a change of income. Eligibility for housing programs should be updated in HMIS whenever there are changes. If someone was doubled up during initial assessment, but now lives in the shelter, Information needs to be updated in HMIS as soon as possible. All housing and supportive service projects that can be accessed through referrals from the coordinated entry process should update their referral sources annually. Information to update includes geographic areas covered, entry requirements, service model, and prefaces for specific subpopulations.
Does anyone have any questions about the updating of information? Thank you for that, Therese. Okay, next we're going to move into our largest collection of information. It's going to be the HMIS walkthrough of coordinated entry. And at the end, we'll address all of your questions. And Daniel has made himself available to us to do just that. So thank you, Daniel, and thank you for this great presentation that we're about to show you. So this will take me just a moment. If I can manage to click on the right thing. See this kid here? It's what you look like when you don't update your chats and have to do them all at once. Okay.
Hello, this is Daniel Gore, your HMIS Administrator. Today I will take you on a guided tour of the coordinated entry system as seen in HMIS from the perspective of different homeless service providers. To start, I'm in the system as Open Arms Emergency Shelter. In my scenario, I have a client who is staying in Open Arms for the very first time. I've done a search for the client, and now I'm going to enroll him in the program and check him into the shelter. I've just done my search for Buddy Guy. He appears in the system, fortunately, so I don't have to create a brand new record. I simply click on his name, and his information loads. Quickly at a glance, I can see there is some case history here. Again, this client has not stayed at Open Arms before, so there is no Open Arms enrollment yet. You can also see there is no open coordinated entry enrollment. So to start, I will do an intake for our DSS shelter and quickly complete these steps. Since this client already has a record in the system, you'll notice information has already carried over, though as always you want to review for accuracy and completeness. A client may answer or not answer a question when they meet a provider for the first time, but they may choose to answer when they interact with you. One example I want to highlight is veteran status. There have been questions about what this actually means. And if you just go over to the blue question mark just to the right of this question, as well as most other questions, you'll see some additional information. And as you can see here, veteran status here refers to whether or not the person has been on active duty in the U.S. Armed Forces. This does not include a reservist or the National Guard unless they were activated. So if someone had served in a foreign army in another country, that does not count. We are specifically talking about active duty in the U.S. Armed Forces. Again, you have those question marks throughout the system to help you answer or clarify for your clients any of these questions. As I proceed, I'll just click through until we get to our enrollment screen, where I will select Open Arms Drop-In. For the sake of our demo, I will say this client checked in last night on the 26th. Since this client does have case history in HMIS, you can use the default button where you see it to pull in the last responses given. And that will populate any applicable questions. So for example, in this case, disabling condition was set yes, and you can just leave those answers unless you have any contradictory information or more accurate information to provide. For living situation, I'm answering where the client stayed the night before they stayed in this shelter. So in this case, I will say the client was in a place not meant for habitation. They had been there for a month or more, but less than 90 days. For shelters, we ask you to approximate when that date of homelessness started by asking the client questions related to that episode of homelessness. In this case, the client says their homelessness began last month on the 25th. And regardless of where they stayed last night, how many times or how many episodes of homelessness have they had in the past 3 years? In this case, we'll just say one time, continuous since last month. And the total number of months the client's been homeless is roughly 1. Again, we're measuring in months. It may not be exactly precise, and for clients who are experiencing homelessness for the very first time, you just simply select 1 month. There is a default button for insurance. I will click on that and we'll scroll down and see that Medicaid has been pulled in. I'll click on Save. Disability information carried over. We can see that a chronic health condition was identified. You may see also additional text or comments to the right, if any has been provided and shared from previous encounters. I'll pull in the previous responses for domestic violence, and for the sake of our training, I'll breeze through some of these questions that we're familiar with from previous trainings. I'll click default for the financial assessment, and there were some answers that populated over no to both income and non-cash benefits. Now that I've enrolled the client, I'm going to quickly check in that client so that we have that documented stay in our emergency shelter, which is documentation of homelessness. To quickly do this, I'm going to click on check-ins. There's a couple different ways to do this, as this tutorial right here covers. But for the sake of our demo, I'm just going to do a very quick single person check-in into Open Arms Drop-In. And again, this person came in last night, so I'm backdating that to yesterday. Clicking Save. And that client is now checked in for 1 night. So as you know, a coordinated entry assessor could be any number of shelter workers or outreach workers or even DSS staff across the county. This is a shared program in HMIS. So if you see an open coordinated entry enrollment here, even though it's not from your organization, it's still one that you can interact with. You can add information to that, including a new assessment, which we'll get to in just a moment. But for the sake of the demo, I'm going to change my organization to DSS. And I'll pretend that I'm a DSS worker doing a coordinated entry enrollment. So if I go over to our intake, coordinated entry is available. If you don't have this option available, you're not authorized to be a coordinated entry assessor, and you've likely not completed one of these trainings. So discuss with your administrator if you don't have access to this already or after your training. When I click on coordinated entry, a workflow will begin. And like our previous workflow, this will guide us through the correct screens to get the client enrolled. No new information is required here, so I just click on Finish. The household hasn't changed, it's still a single person. Coordinated entry is an option on this list, and it should be the only option. And when you do the enrollment and choose a start date, if this is happening at a shelter or at transitional housing, be sure to change the date to when that client came in to your agency, because we want to make sure that this coordinated entry enrollment is capturing the earliest activity that they've had at your agency. This goes a long way to ensuring that that activity is captured behind the scenes and ensures that their coordinated entry enrollment remains open and active for the duration of their stay in your shelter or in your transitional housing. And it's just good practice. So I will go ahead and change that date to the 26th. Click on Save. Again, information will carry over. So I click on Default Last Assessment. And this form does look slightly different for coordinated entry assessors. There are some specific instructions here. So for example, we're asking, where is a client currently housed? Because in this case, we understand that this is likely happening sometime after the client has entered shelter. So it's worded slightly differently than our shelter entry. In this case, we'll say the client is homeless. They are in emergency shelter. That is a homeless situation. And what's been the length of stay in their current situation, their current homeless situation? And from our earlier assessment, we know that this homelessness started last month. So I'll click on the 1 month or more, but less than 90 days. You may find it helpful to look at these instructions below and see if there's more information quickly at hand. This could include viewing previous shelter episodes. So in this case, I see the one and only episode here at Open Arms, but this would show me if the client has had any previous stays that might change how I answer this and some of the other questions. It's also worth clicking on View Documentation, because from here you may see that, say, a client met with an outreach worker or with another agency, and they were able to provide some documentation of other homelessness that may have happened outside of the county and not captured here in HMIS. So this is very important as well. So once you have a more holistic view of the client's homeless situation, you want to take what is documented and only what's documented to answer the next questions. You want to approximate the date the homelessness started. Again, in this case, it only began last month on the 25th. But if you had, say, that documentation of homelessness in the form of a letter that showed that they were in a shelter in the Bronx since the 1st, you could go back to September 1st. Again, you would only want to do that not based on self-reported information, but what has been provided to you and what's documented and uploaded here in HMIS. Regardless of where they stayed last night, how many times has the client been on the streets or an emergency shelter? Again, based on the information we have, and again, this is coming from our shelter stay, but also from that homeless outreach episode that we saw earlier on the client's dashboard. I'm able to go back to 9/25. The system will give you a nice preview here of the total number of months homeless. So this is going to do a quick calculation based on the number of shelter stays in HMIS as well as the number of outreach contacts in the past 3 years. So to answer this question, how many months homeless has this person been in the past 3 years? If it sees shelter stays, it's going to take all those days, add them up into number of months. If it sees during the course of a month where the client wasn't in shelter, but there was an outreach contact, that outreach contact will count as another month. It will be added to the total. In this case, we don't have that situation. We just have the 1 month where all this activities occurred. So I want to take that auto calculation and fill this out. So this is just a nice tip that we've been able to build into the system. Please use it. At this point, there is a disability that's still documented here. As a CE assessor, you will want to take note of that because this may be a vital piece of information when DSS evaluates for housing placement. There may need to be documentation provided as to specific disabilities. So this alone may not be sufficient for whatever the referral and intervention is. So just keep that in mind, that whatever you record here or has been recorded may come up in a conversation with DSS when they're navigating housing options. I'll click Save and Close. Domestic violence, that's still no. The client has not been a victim of domestic violence. And move on to financial. And similar to barriers and disabilities, information here may come in to conversations later when referrals or housing interventions are being discussed. So just keep that in mind. And now we're on to the chat. There is a full training that is being done today on the chat, so I'm not going to attempt to do that here. I'm simply going to show you some of the more technical aspects of the chat here in HMIS and explain what you're seeing. So as it says at the top, the information that you provide here will be used to determine permanent supportive housing and rapid rehousing scores as possible, 2 possible interventions for this client. The assessment date needs to reflect the date of when the assessment was done. You can type in the assessor's name here. That person does need to be a user of HMIS. More than likely you're the person, so just type in your name and it'll populate the rest. Some information we'll pull in from HMIS data. So we already have the client's age populating. We already know that the client is currently living on the streets. And to clarify what we mean by that, this is looking at any recent outreach contacts. And we know there wasn't a recent outreach contact, so this does say yes. And that, and the fact that the client is in shelter, either of those would make this client a yes for the next question, which is, does individual have prior episodes of homelessness? So an outreach contact and their stay in the shelter, which just started, would make this a yes. I'm just going to quickly answer questions that need to be answered on this form. I'm not going to go into, again, how you administer this. That'll be covered elsewhere in the training. I do want to stop and highlight here under employment, if the client is employed, you do have essentially a spreadsheet here where you can add all the client's employment history over the past 24 months. I'd recommend you start with the most recent employer and work your way backwards. Then based on that information, total number of months employed in the last 24 months. And this will auto-populate. The last pay rate will come from the most recent job. Next up is, what is the monthly household income? And to be crystal clear, we're not talking about just the individual's income. So in this case, we are working with a single, so we're talking about just this one person's income. But if you're doing a chat for a family, you want to include everybody's income here on the chat. So you may have just gone through the workflow and assessed 5 family members, 2 of them are adults with income. Take those 2 adults' income and combine it here for your household, your monthly household income. The system won't do that for you, not at this time. So just make notes of each adult's income and record that here. There is some additional information as far as instructions on how you proceed with the rest of this. Stop here if monthly income is below this number, currently $821. And the system is going to set the RRH score to 0, since that would not be likely a very appropriate intervention. Just for the sake of the demo, I will talk some about the RRH questions below. Educational information is pulled in. Rental history is another spreadsheet here where you can enter in the last 24 months rental history. I recommend you start with the most recent residents and work your way backwards. And then total up the number of months housed based on the above. And I'll go ahead and skip over the rest of these because no matter how I answer these questions, the RRH score will be set to 0 based on the previous information. At this point, you see there are 2 scores now being generated, a 5 for PSH, a 0 for RRH. You have an opportunity here to include any notes that you would like or comments that you would like, knowing that this is an assessment that might be seen by other assessors, that might be seen by DSS, when, the coordinated entry lead in this case, and anyone working on the coordinated entry housing work group. So just keep that in mind. Feel free to include any information you feel was not included here or information that you think others should know. And at that point, click on Save. And there are 2 more steps to go. So at this point, even though we know we just did that assessment, if at this point you have documentation to upload, if your client did have any certificates of homelessness and you were able to attain those, you could upload those here. Income verification, documentation of disability status, etc. If you don't have that information at this time, and again, you may not necessarily need it for every client, unless it's necessary for referral, you can go ahead and just skip this. You can always come back to documents at a later point in time. What you do need to do, however, is record the client's risk for severe illness due to COVID-19. As will be discussed today in the training, the coordinated entry policies and procedures have been amended temporarily due to the health emergency. And this risk status is used in prioritization for different housing interventions. And it's very important that everyone who has a chat, and that's your head of households that you enroll, they have a risk assessment. And that's what we're going to do right now. So click yes, let's enter the risk now. And what we use to do that is a screening tool. Now, this is a screening tool that's available to you at any time in the system under the assessments menu. We're not doing a complete assessment right now. So you'll see that there's information here that you would use for clients entering your facility. That's not relevant for the purposes of coordinated entry. What I want to do is just take you down to the required question for assessing risk, which is here under risk assessment. So this will not be auto-populated based on any HMIS data. This is very specific. This is also dynamic and can change based on CDC guidance and recommendations from Westchester County Department of Health. So what you want to do in this case is evaluate everyone in the household. And we understand this is, you are not doing yourself a clinical or medical evaluation, and your trainer will talk more about how you answer these questions. But what you want to do is evaluate everyone in the household, because this risk assessment will be used for everyone in that household. So in this case, my single client has COPD. I'll select that from the list. And looking here at our options for risk tier, I need to select one of these options. So my client is not 65 or older, so tier 1 and tier 2 are not applicable. Tier 1 being 65 or older with one or more of those above documented risk factors. Tier 2 being 65 and up, but with none of those risk factors. And tier 3 under age 65 with one or more. Our client is tier 3. And because I did select the risk tier, the system is telling me, based on this little red asterisk, that I definitely need to select at least one of these risk factors before I can click on save, which is what I'll do right now. So we've documented the risk. I will now click finish, and this will take us back to our dashboard. As a service provider, there are a few things that you need to note when working with clients and how it impacts their status in coordinated entry. For one, if a client is staying in your shelter, you need to ensure to check them in and check them out in a timely fashion. That allows other providers to document stays at their facilities, but it also indicates to the system whether or not the client is still active. If a client doesn't have any shelter stays, outreach contacts, or outreach notes, the client will be auto-exited from the system, typically after 30 days of inactivity. So I do want to show very quickly, since we've already looked at check-ins, I do want to show very quickly how outreach contacts are recorded, since we didn't cover that already. So in this case, I'm going to show you the perspective of choice outreach. So let's say in this case, choice went out and they were able to make contact with Buddy Guy. Let's say he's left the shelter, but he is still experiencing homelessness and choice is still in contact. By clicking on services, you'll see there's an option here to record an outreach contact. And any outreach team is encouraged to use this. You simply have to have an outreach enrollment that's open, otherwise you can't record this specific service. And it's as simple as that. Additionally, if you're not able during these times to make physical contact and verify the client is experiencing homelessness, we do want outreach teams who are still making attempts. They might be calling the person to record that activity. And through that activity, the client will still remain active and enrolled in coordinated entry. So how do you do that? Outreach teams will go to case notes, click add new. And like I said, this is used in cases where an outreach attempts are being made. This is not used for recording the physical outreach contact where you're able to verify someone's living situation. So in this case, I'll say call attempts. And more or less this works just like any other case note. And you can include whatever information you want in this section. Click Save. And now we have that case note, which again is counting as activity toward coordinated entry. And that client will remain enrolled in coordinated entry from this date forward, at least for 30 days. If there are still attempts being made, that 30-day clock will continue to be pushed out. I just want to show you how you as a shelter or housing provider can quickly check your current roster of clients and what, if any, action you need to take around someone's enrollment into coordinated entry or having an up-to-date chat. So under the housing screen, this is where all the emergency shelters and some of the transitional housing projects record check-in records. And this is often used to do at a quick glance to pull a daily census or nightly census. And what we've included here is the ability to quickly filter any clients based on certain criteria. So for one, if you wanted to see all the clients in that were checked into your shelter last night who were not active in coordinated entry, change this to no. Now, drop-in shelters operate slightly differently. Drop-in shelters do not have to enroll every client into coordinated entry or check to see that they're enrolled in coordinated entry. But they do need to see if any of the frequent users of shelter services are staying in their drop-in, because we do want to prioritize those frequent users of shelter services. So that's what this filter is doing. It's looking for anyone who was checked in last night, who was not active in coordinated entry, but they are a frequent user, meaning that they've had 14 or more days in shelter in the past year. Additionally, one useful filter to use is by doing a search for anyone who is active in coordinated entry, but who does not have a chat. Sometimes this happens. Again, not everyone in your facility receives their own chat. This is usually just reserved for the heads of household. So I'm going to turn on the filter for heads of household only, those who are active in coordinated entry, and I want to see who does not have a chat. And nobody matches that criteria. Now, if someone did, they would have been displayed here, And as you will see, there is a button next to everybody that will allow you to quickly select their record so that you can navigate to the appropriate screen where you need to either enroll them into coordinated entry if they need to, or add a new chat if they don't have an active one, and do what you need to do to ensure that those clients are being considered for the appropriate resources and appear on the prioritization list. At this point, I want to show you the coordinated entry system from the perspective of DSS and your housing navigators. So in front of you, you now see the prioritization list. This is what DSS and the coordinated entry team uses to identify clients who may be eligible for various openings, as well as to manage the entire referral and placement process. Just as a quick overview, at the top of the screen, there's the ability for the coordinated entry lead team to filter based on scores. So scores of 5 or more are prioritized over 0 to 4. And there are different ranges for RRH scores, as well as various filters based on the different criteria and considerations for any given housing opening or resource. So what happened to Buddy Guy? Let's take a look. What I'm going to do is search for a PSH opening, starting with the clients who are the highest scores. So I just did a search of my list, and we now see 2 clients. We see Donald Duck and Buddy Guy. And the coordinated entry team, when they see this, they're reviewing a lot of information here on the screen, but also reviewing notes as well as other information behind this record. As you can see, there's notes that are made, there's eligibility information to consider, etc. We can see that our first client, who is higher priority based on the total number of months homeless, has already been referred. There's a referral record here. In this case, it says to DSS, but that client is being referred, and they're on their way to receiving a COC resource. So for the next up, we have Buddy Guy. He's the only other client who's here on our list. And this person, for the sake of our demo, is eligible for a PSH opening. So what would happen then? Very simply, the client's information would be reviewed in detail. And there would be conversations with the housing provider. Likely documentation would be reviewed, and there might be communication about gathering that documentation. But what I want to show you is what happens in HMIS, and that is a referral being generated by the coordinated entry team at DSS. So I will generate this referral for today for permanent supportive housing. There's a way to narrow down the search to particular organizations. In some cases, there may be openings across multiple providers, say for DCMH Rep that operates across many different providers. So I'm just doing a quick search here for PSH, and we'll see in my demo site, I do have a few providers of that housing service, and I will go ahead and select DCMH Rep. A referral can only be made for a client that has an active enrollment in coordinated entry, which this client does. An email will be generated. And what's going to happen is you'll receive that referral notification with instructions, and we'll see what those look like in just a moment. So right now, the outcome of this referral is simply that it's a new referral. There's no other outcome at this time. There's no appointment date. There's no results just yet. When I click on finish, the system will say, here is an email template you're welcome to use. But this can just be used to quickly email the appropriate personnel at the housing provider to let them know that someone is on their way. The process has begun. There may also be additional instructions provided to that housing provider. There might be copied here, say the shelter provider, so that collaboration can begin around collecting required documentation and other information. So obviously a lot of communication happens outside of HMIS, but this is the referral record documenting the beginning of that process. While you don't see the system-wide prioritization list, you do see your clients and activity on their screen. So you would see the referral and you would see the status. Now I'm going to switch gears and show you how this referral looks from the perspective of DCMH, the housing provider. So I'm DCMH now. I've received an email notification telling me that I need to go into HMIS and take a look and acknowledge a referral is coming. You will locate that under the incoming referrals screen. So over here on the home screen over to the left, incoming referrals, and sorted in order of newest to oldest, you'll see your incoming referrals. So these would be any that are new, those that have been acknowledged but don't yet have a result such as accepted or rejected. So what I'm going to do is click on edit here. I, as a housing provider, want to tell the coordinated entry team that I have acknowledged, or maybe I've accepted, or maybe after that conversation with the client's rejected, or I've rejected the client for various reasons, which are explained in our policies and procedures. So in this case, I'm going to go ahead and not just acknowledge, but I'm going to accept the referral. You can also provide some comments here that you can share up to the coordinated entry team. So this information at the top is coming from the coordinated entry team, and then below here is information that ERS will provide as far as updates to the status of this referral. I will go ahead and click on save. And because I've made an update, HMIS is saying, let's go ahead and let the person who sent you this referral know about this change. So at this point, we're not including any personally identifiable information here. We do have the client's HMIS ID number, and you can use this window to include any comments, additional information you wish to share with the coordinated entry team. And now you can see that that referral for Buddy Guy is no longer here. This is only showing your incoming referrals. If you're ever curious, you can always find a complete history of your referrals under the provider screen, which is a completely other section of HMIS that you reach by clicking on these blue buttons at the top of the screen. And as the housing provider, of course, if a client's been accepted or admitted into the project, the next thing that you want to do is do an intake as appropriate based on your data collection standards. And so in this case, this is a standard intake being done for DCMH wrap. We do not have a housing movement date yet, so that will be completed later. Oh, and now we're back onto the client dashboard And we can see a very clean, not necessarily typical client interaction with the Westchester County Coordinated Entry System, from their first point of contact with the outreach team, to a stay and emergency shelter, to their coordinated entry and chat being recorded, to then their enrollment into a housing provider. Always opportunities outside the workflow to record, say, documents that need to be uploaded, services that need to be tracked, notes that need to be recorded, check-ins to shelter that need to be done. Or additionally, if someone has been in coordinated entry for a very long time, let me go here to assessments and click on chat. You may see that they need to be reassessed. That option that you see right here to add or edit a chat. And it will just take you through that workflow to record that information. If you didn't have the opportunity to record someone's COVID-19 risk, you can do that here as well. And you can always review information that you may have entered. So that concludes this portion of your training today. I hope you enjoy the rest of the training and learn a lot that you can take back to your organization and deliver the best quality care to your clients. Thank you very much.
Hi, and welcome back, everybody. So let us look at questions. I don't see questions.
Right, there are no questions regarding Daniel's presentation.
Okay. Does anyone have any questions now that they've finished watching it that they would like to ask?
Oh, wait.
We gave you folks a ton of information today, so it's totally understandable that you need to digest it and get back to us. We are not going to have a run through of the chat today, but we are next time going to have a shorter training where we will do the chat. We'll do a run through of that and how you should be responding to questions on behalf of the client in it. You know, asking the client questions in a way that they can provide you with most accurate information possible. And we'll also be covering the shelter site visit requirements. Yoav and Craig will take us through that. That's a date to be announced in the future. For now, we have about 10 minutes. So if you have any questions from anything you saw today that you'd like to bring up, now's the time.
All right, before we even get into the questions, just a quick reminder to those who called in. So your names do not appear on the participant list, so please email Latanya with your name and your agency to receive credit for attending today's training.
All right, Craig, it looks like there's no questions and we're ready to wrap up.
Well, we wanted to thank you all for participating. It's been a lot of information. We are pleasantly surprised at the attendance. We actually had to turn folks away because we reached capacity for some reason. But, you know, thank you all. We will be blasting out this information. We will let you know when it's available on the website for review. And but in the interim, please reach out to us. We're available for any questions, any needs that you guys might have. I really want to thank Allison, Jesse, Daniel, Treese, Yoav, everyone who was involved. It took a lot of effort and a lot of time. We only had minimal interruptions, thankfully, with our technology for our first one. So we look forward to just, I guess this is the way we're doing things now. So we'll just make the best of it. And we just want to provide the support that you guys need to do the great jobs, the great work that you have been doing. So really, that's our only goal. We are going to be sending out a survey. Please let us know what worked well, what did not, what you would like to have seen differently. And any suggestions that you guys have, please, please, please let us know throughout the days, weeks, months as we proceed. That really helps us to provide the support and training that you guys might be interested in. So with that said, I have nothing else to say. Jesse or Treese or Allison or Yoav, anything you guys want to add, or Daniel, if you guys think of a question after, let us know. We're available.
Right.
All right.
And definitely all of the content that you've seen today, including this training in its entirety, is going to appear on the website, wcochomeless.org/coordinated entry. The entire thing will be there, as well as the individual segments. If you just want to revisit something in particular that we covered today. So please let us know how we can help you, how we can support you, and what we can do better. And we appreciate all your time.
And I have nothing to add. So thank you, everyone.
Jesse, Daniel, or Yoav, anything to add before we dismiss?
Nothing at this time, Craig.
Nope.
All right. Okay. All right. Thank you all.
Bye.
Bye, everyone. Thank you.
Thank you.